Welcome everyone again to the Learning to Birth webinar series where we interview the world's most inspiring thought leaders on birth and pregnancy. Today we have with us Lynn Schulte. Welcome, Lynn.
Hi, thank you so much for having me. So glad to be here.
We're going to be talking about a lot of different things today with Lynn, but just a short introduction about Lynn. Lynn is a postpartum recovery expert and easier birth facilitator. Lynn does online courses for mums, confidence in your core, pelvic floor, and more. A postpartum guide to postpartum healing. So Lynn's got a lot to offer us, and Lynn's also runs a really big, beautiful Facebook group. And do you want to tell us about your story, Lynn?
Sure. So I'm actually a women's health physical therapist. That's my background. And about over a decade ago, I started mainly working, I moved to Boulder, Colorado. And so when I moved to Boulder, I had to start my practice all over again. And I started mainly educating moms about the changes in their body after birth. And so then I started filling my practice with mainly postpartum women. And that allowed me to really see one focused specialty group. And I started seeing all these similar patterns in the bodies of these moms that I was working on. And then I figured out how to release those patterns from the body. And all the moms were just like, oh my gosh, I feel so much better. And a lot of times their issues would go away in as little as one session. And and then I kept hearing how much I was changing all these moms' lives by the work that I was doing. And so I started putting on YouTube everything that I was learning about the postpartum body. And then I started getting emails from women all over the world saying, oh my God, I have exactly what you're talking about. You know, do you have someone that can help me? And I was like, not really, because what I have discovered and what I'm doing in my sessions is something I've just taught myself. And so I realized at that time that I really needed to start teaching what I knew to other practitioners, because I can't see every mom in the world. I don't want to see every mom in the world. And so I put together a couple of courses. They're live and in person. There's also some online courses for practitioners, for body workers, to help them understand how to help prepare the body for birth, and then what to do to help recover that body after having a baby. And they've been really well received. I have a certification process now that body workers can go through to become certified birth healing specialists. So I'm super excited. I have over 6 countries currently. I have birth healing specialists in over 6 countries, and we're growing and we're impacting moms' lives. And I absolutely love any chance I can get to share this information. So thank you, Akasha, for having me. I so appreciate that.
We're really, really lucky to have you here, given the wisdom you have, experienced for yourself and that you share. Now, you have the Institute for Birth Healing. Do you want to tell us about what that is and what it does?
Sure. So when I first started seeing these postpartum moms, I went online and started looking like what information is out there. And this is over 10 years ago. And there was nothing, like there was hardly anything online. And I was just appalled at that. Like, holy cow, seeing what I was seeing in the moms that I was working on and the issues that they were dealing with, I was just flabbergasted that there was no information out there for these women to help them feel better in their body after birth. And so that's when and then having this body of knowledge that I knew was making these amazing changes in these women's lives, I knew I had to get out there and teach it to other people. And so I created the Institute for Birth Healing as a platform for good information. My website is divided into kind of 2 separate websites. We have a website just for moms, and then we have a website just for professionals. So, when you come to my landing page, instituteforbirthhealing.com, you can choose whether you want to go to the mom side or whether you want to go to the professional side. And, over those 10 years, over 10 years ago, when I first looked and there was nothing on the web, Now there's actually so much information out there on the web. And actually, while that's great, it's also can be really confusing for moms because now they don't know what to believe. They don't know what is really good. And so I founded the Institute for Birth Healing to be a platform of really good information that I know is effective in helping moms to heal more completely after birth and also prepare their bodies for birth, because the healing after birth really does start when we're pregnant. And preparing our bodies to have a smoother birth will help have a faster recovery. And so there's information that, I think a lot of moms, when they get pregnant, it's so exciting. It's such a great, fun time. But a lot of people aren't really concerned about their body. They know their belly's going to get big, and they may be a little concerned about the labor part of things, but they don't realize the impact that their body and what they bring in their body to their birth and how that impacts it. And the Institute for Birth Healing is really here to make a change. We want to change birth practices all over the world, because what I see happening is that we do great care of a mom while she's pregnant. We do great care of making sure the baby is okay and growing well in a mom's body. But we are doing such a disservice to women, to pregnant people, that we're not assessing what I call the birth door prior to going into labor. And I think that, what I mean by the birth door is that pelvis, the baby needs to go through that pelvis in order to come on out. And we're not, we're just assuming that the body's going to be able to do it. That's how, most moms, they go in and they just take care of the baby and, or make sure baby's growing, make sure baby's heartbeat is okay. But they're not concerned about the body and what that pregnant person is carrying in their body. There's so many existing conditions that women bring to their labors that can really impact it. And so it's my hope and dream with the Institute for Birth Healing that we help expand this consciousness around preparing the bodies for birth, around being aware of what a woman brings in her body to that birth, and hopefully making some effective changes to that body prior to going into labor. Because if we don't address it prior to labor, it's too late. And yeah, and one of the biggest things that I find makes that challenges the pregnancy and the labor is appendectomies. I see all the time if a mom has had an appendectomy any time in her life, even as a child, that uterus gets pulled over from scar tissue from that surgery. And scar tissue, and doctors don't have any clue about how scar tissue really impacts the body. And scar tissue limits our mobility of the tissues. It just glues things down. And after we've had our appendix removed, it glues the uterus down over to the right-hand side. And then the baby can't get into the best position to come on out. And so I really, I just would love more midwives, more OBs, more body workers to understand that we can assess that belly. The belly is one of the main key pieces that we need to assess prior to going into labor. And moms, you can just move your belly side to side and see if there's good mobility and even mobility side to side. And you can know if a baby is only hanging out on one side of your belly and it never really goes over to the other side. That's a key sign that you might have restrictions in your abdomen, that your baby can't. Yeah, that the baby needs to be able to get into whatever position it needs to come on out. And if we have restrictions in our abdomen from either uterus being too tight on one side or that abdominal fascia is too tight that is surrounding the uterus, baby gets restricted. And then baby starts coming out asynclitically, which means it's coming out cockeyed. Instead of being nice and aligned in midline, it's kind of coming out at an angle. And when it comes out at an angle, it's so much harder. And so one of the key things that I hope every mom will do prior to going into labor is to make sure that that baby's head, this is your pelvis. This is called the pelvis, the pelvic inlet. And we want to make sure that baby's head is right in the midline and not heading off into one hip. And so many women, they start their labors with the baby's head heading into one hip. And the uterus has to work extra hard to get the baby's head into the inlet. And to me, it's just astounding that we allow that to happen. You know, it's like, ugh, we can do something, we can free that up. And if we allow that, you know, if we can get some body work prior to birth and make sure that we have symmetry and we have space for that baby to move and get in whatever position it needs to, we can have so much of a smoother birth. And that's really my hope and dream for all moms. And that's why I founded the Institute for Birth Healing, so that can happen.
Well, I learned so much there. I'd never even occurred to me. I know, I mean, there's breech births, there's footling births, there's all sorts of different births. I never really thought, like, what if the baby's head is just slightly off? That never even occurred to me that that was a possibility. So my mind's been a bit blown there, Lynn.
Yeah. It's very, it's actually a little bit, I don't know how common it is, but you know, that baby's head needs to be right in that midline. And sometimes the baby head comes in at an angle, and that's called asynclitism. That means the baby's head is kind of coming in a little, you know, like we want the top part of the baby's head. And hang on just a second. I'm going to see if I have
That's okay.
the baby. Oh, I can't find it.
That's fine.
Sorry.
I
was looking to see if I had a baby right near me, but I don't. But you know, the baby's head, if it comes in this direction, it's so much easier for it to get through the pelvis. But if it comes in cockeyed, like the bigger part of the baby's head coming through here, so much harder. And you know, that's why births last so much longer when the baby's not coming through easily. You know, there's a bell curve for birth, and 22 hours is like the average. And so anywhere in that 22 hours is considered normal and average. But when you start getting a labor that's going 30 hours, 40 hours, there's something going on that is not lined up. And I believe that if every mom had body work done, if every mom could be seen by a birth healing specialist, that we could really change our cesarean rates. We can change helping moms have smoother, easier births. And that truly is my goal.
You know, for a mom coming to this who does, I mean, what is body work if she's never had it done? What does it feel like? What does it do?
Right. So body work is actually, you know, a massage, acupuncture, chiropractic, physical therapy. It's a manipulation of the tissues of the body. It's creating change in the tissues of the body. And so what I train my practitioners who become birth healing specialists is to be able to feel for the restrictions in the tissue. So tight muscles, tight fascia, tight ligaments. We're assessing to see if there is an imbalance in your body, and we all have it. The way we sit, the way we move, the habits that we use, we don't use our body symmetrically. And so then we have tightnesses more on one side than the other. You might notice, like if you raise your arms up and one arm can't go up as high, right? That's a restriction in there. Yeah. Those types of things. Having pain, you know, pain in your body, not being able to move your joints and limbs as freely as you should. Those are all signs that you really need some body work. And when it comes to pregnancy, being able to move your baby side to side in your belly, and if it doesn't move evenly, that's a sign that you have restricted tissue in there and that your body could really benefit from body work. And so what I like to teach my practitioners is how to really respect the tissues and help them to release. So there's a way to get those tissues to release that doesn't have to cause pain. And that's so important for me, in that I don't like there, you know, there's some, sometimes there's a little burning, sometimes there's a little stretch of the tissue, but it shouldn't be where you're wincing and like, off the table. You know, it should be, you should be able to breathe through it, and it shouldn't be painful. So body work is getting those restricted tissues released and allowing more freedom of movement in your body.
Yeah. So it's basically you come in and you have a bit like a massage, is that it? But it's a very specific massage. And I'm guessing you're going to be moving the limbs in different places to access.
Well, it depends. So for pregnancy, I don't tend to work as much on the arms and shoulders unless mom's complaining of carpal tunnel. Like, so depending on what a person is complaining of, when they come in, you know, then we address that part of the body. But when we're dealing with pregnancy, there's really 3 key areas of the body that I like to assess to make sure that a mom is ready for birth. And we've already talked about the abdomen. The abdomen is one key area. We need to make sure that we've got freedom of movement side to side in that belly to make sure baby can get into the best position in there. But then we also need to look at the pelvis and these pelvic bones, okay? So this is your pelvis, and this is your pubic bone in front. These are your iliac bones. These are your sit bones. These are the bones that we're meant to sit on when we are sitting. And then back here is your sacrum, and this is your tailbone. And this pelvic ring, actually, I was talking earlier, this is your pelvic inlet, and this is the pelvic outlet. Well, for birth, what needs to happen is that the inlet needs to get wider. So the sacrum tilts backwards and these ischiums come together so that the iliums widen. And so all that increases this diameter for the baby to be able to get in.
Yeah.
Then once the baby hits the pelvic floor muscles, then these bones need to go the opposite direction to open up to allow the baby to come on through. Now, that's a lot of motion for these bones, right? And what if you've had traumas or falls, or you've injured your tailbone anytime in your life? That could be an indicator that maybe these bones may not move as easily. It's not an indicator that the baby will not be able to come out of your pelvis. It may just mean that it might be a little bit more challenging, okay? And so getting this assessed, this joint right here is called your sacroiliac joint, and there's 2 of them, right where the sacrum meets these iliac bones. And do you see how this is the hinge for birth? Okay, so this sacrum needs to move backwards to let the baby in, and then it needs to lift backwards to open up for the outlet for baby to come on out. So this is a hinge joint. And low back pain is so common for our pregnant moms.
Oh my God, yes.
Right? And so many providers just write it off and say, oh, you're pregnant. You just deal with it. Well, if that pain is coming from that sacroiliac joint, then it's possible that that joint's not going to have the ease to be able to open up like it needs to. And so one of the things that I train my birth healing specialists to be able to do is to assess these bones to make sure they can move as they need to for birth. And we can assess, sometimes the sacrum does not sit in as evenly as it should. Sometimes there's a rotation in it. So one side is higher than the other, or this bone might be a little bit more prominent. So the sacrum's kind of twisted in there a little bit. And we can work to release that, to open it up so that there's a greater opening in here. We don't want this sacrum to be tilted like this, right? It's not going to create as big of an opening for that baby to come on through. And so the birth healing specialists that I've trained know how to work with these bones to help open up the pelvis to allow the baby to come on through. And then the third area that I really make sure I always assess in all of my pregnant moms is that the pelvic floor muscles. I have another pelvis here. Okay. This has ligaments, and then these are the pelvic floor muscles. So can you see that here's the pubic bone in front?
Yeah.
These are your sit bones. Okay. And then back here is your tailbone. So
Yes.
all these red tissues are muscles, and these are your pelvic floor muscles. Okay. So maybe you've heard the term Kegel. Can you do a Kegel? Well, that is a contraction of these pelvic floor muscles. Okay, means the same thing. Dr. Kegel just got a contraction named after him. I mean, who knew that you could do that? But anyway, these muscles, these muscles are the muscles. Do you know, have you ever gotten, Akasha, have you ever gotten those knots in your shoulders?
Oh, yeah.
Knots in your muscles, right?
Yeah.
Those same kind of knots can be held in our pelvic floor muscles. So we can have tension, we can have knots in these pelvic floor muscles. And so if you can see with my movable pelvis here, if my hands are those muscles and I've got a knot over here, what's going to happen for that baby trying to come through? It's not going to open up over here. So now this side's going to have to open up even more.
Yeah. Yeah. Wow.
See that?
Yeah.
So it's really important that for birth that we have nice even tone in these pelvic floor muscles so that the sacrum can open up backwards nice and evenly. Does that make sense?
This is a really good description. And I mean, I went to see a pelvic floor physio specialist after my baby because I was having so much pain down there. And, you know, she helped me get rid of knots there. Like, I think probably that it occurred as a spasming from like the postpartum pain. But yeah, I'd never really thought about the impact prior to birth of these things. You know, that's really, really super interesting.
Well, and I call the pelvic floor muscles the stoplight for birth.
Yeah.
Because what I have found is that, you know how we were talking about baby's head heading into one hip?
Yes.
Okay.
Yes.
What I have found when I've worked with a woman who's had that is that her opposite side pelvic floor muscles had too much tone in it.
Oh.
So it actually, like, too much tone repels the baby's head away.
Yeah.
And there are pelvic floor muscles that have so much tone in it that the baby can't even engage into the pelvis.
Yeah. Yes. Yeah.
So the pelvic floor muscles are like you know, they repel. If there's too much tone in it, they repel the baby away. And so I call it a stoplight for birth. Red light tone, too much tone, baby is not coming on out that way, okay? Yellow light tone just means there's going to be a lot more resistance for baby coming on out. Ideally, we have green light tone in both sides of those pelvic floor muscles so that the bones can just open up. The bones can only open up to the degree that the muscles can. Okay? So if the muscles have a lot of tension, a lot of tone in it, bones can't open up.
Incredible.
So I had a doula that came to see me. She was pregnant with her second baby. And during her first labor, she tried to do a home birth. She got to 4 centimeters dilated, wasn't progressing anymore, had to transfer to the hospital. She got an epidural and then was able to have a vaginal birth. Now, when I saw her for her second pregnancy, her pelvic floor muscles still to this day win the award for the tightest pelvic floor muscles I have ever palpated, ever worked with. They were bricks in there. And I was like, well, no wonder you needed the epidural, because the epidural can bypass some of the tension in the pelvic floor muscles.
Yeah.
Okay, so they kind of like make things more flaccid in there.
Yes.
And so more relaxed. And so I usually in my sessions, I can get pelvic floor muscles to relax in one session. For her, it took us 3 sessions to get those muscles to relax and to get a little bit of bounce and spring to them. She was able to have a vaginal birth at home after those sessions. And I truly believe that had she not done that work with me, she would have needed the epidural again. It's so, so important. And so what I want to talk to everyone about is this idea of perineal massage. Did you do that when you were pregnant?
Oh yeah, I did.
Okay.
Yeah, I did. So tell us all about it, because that's actually something we haven't talked yet about in these
Okay.
Will be a new
So let me ask you, Akasha, if you don't mind, when you did the perineal massage, what were you focusing on?
I think stretching the perineum. You know, I don't think it really did anything for me.
Right. Well, so this is your vaginal opening right here, okay? Yeah. And so I feel, and this is just my sense of what's happening out there, is that when we talk about perineal massage, that moms will stick their finger in vaginally and they'll just kind of work that opening right there.
That's how I was taught it. Yeah.
Okay.
Yeah.
So the skin at this opening is going to respond to, so the fear is that this is going to tear, right? So we need to massage it to open up so it doesn't tear.
Yeah.
Well, what's actually way more helpful is not worrying so much about this opening, but coming in here and worrying more about these muscles inside here.
Whether they'll give.
And whether they can spring and bounce and open. Okay. Yeah. These muscles need to be like trampolines. And when you push on them, they give. Okay. And we want them to give evenly both sides. Okay. So, these muscles here, if you stick your finger in vaginally, right at 6 o'clock, I think of this as a clock, right? 12 o'clock is where your urethras and the clitoris is. 6 o'clock is where your rectum is, okay? So if you stick your finger in past that first knuckle, you'll be on your rectum. So don't push there, but go off on the right-hand side and press down at like between 7 and 8 o'clock, and then 4 and 5 o'clock on those sides of the rectum, and press down and out. So I like to use my thumb if I'm doing it to myself, because this is so much easier to access.
Yes.
And so just press down laterally, diagonally, and press down diagonally here. And you really want to stick your thumb in past that second knuckle here, past this, get it all the way in there. And then you actually just kind of have to curve it down to get in contact with these muscles, and then press down at a diagonal and see how those muscles react. Okay. And they should be even, nice and springy. And if they're not, if you notice tension on one side, put pressure there and just breathe down into it. Okay. And just hold it and see with your breath, your awareness, with some pressure with your finger, your thumb, see if you can't get it to melt and relax.
Yeah, this is really important, Lynn, because that's pretty much what the physiotherapist did for me after birth. And frankly, if I had have known to do this before birth, I probably wouldn't have been in that place after birth. So,
right?
Yeah.
Yeah. And that's why, I mean, these guys are so, so important. And yet nobody is assessing them prior to labor. And this it kills me, because they're just so important. And I've taught midwives now. I've taught so many midwives now that, you know, when a labor stalls, they go in and they release the pelvic floor muscles, and then baby just comes right on out.
It makes so much sense, doesn't it? I mean, if you're not relaxed. And see, actually, I mean, this is a bit more about me and my story, but, you know, for my second birth, I knew that, you know, there's other mamas out there in this world. There's been plenty of them documented, like by Anna Mae Gaskin and her books and so forth, that mamas that just like give birth in an hour. And I was like, there is no difference between me and them. They're just doing something. And if the baby's going to come out, it must mean that they've relaxed. So I was like, I put myself on a total journey of learning how to relax for that second birth. And it meant I was able to birth, you know, in under that hour. I mean, that was just me. Everybody is different. But for me, I focused on learning on how to relax those muscles. So what you're talking about makes total sense to me.
Absolutely. And that's the key. The thing is too many childbirth education classes are teaching that we must strengthen these muscles. Okay. And they're telling, some childbirth classes are saying you need to do thousands of Kegels every day.
Whoa.
And it's like, oh my God, no, we don't. It's the exact opposite. So what's happening, if you remember, my hands are the muscles. And so if we're doing Kegels and Kegels and Kegels and we're strengthening, what it's doing is actually closing down the outlet. It's making these muscles tighter so that they have a harder time in opening up for birth. So you are spot on, Akasha, that it's definitely relaxation that needs to happen here. And so many women are walking around with tension in these muscles and they have no idea. A lot of the dysfunctions that happen in the pelvis is because of too much tone in these muscles, not too little. But yet, what's the number one advice anybody gets if they go to their doctor and they're complaining of leakage or in intercourse pain or pelvic pain, anything down, prolapse? Do more Kegels. Tighten up those muscles more. That'll stop the leakage. And actually, it's not. So we need to help all of our pregnant mamas learn how to relax these muscles. In fact, in my, I'm developing a smoother or simple steps for a smoother birth. And in my online course, I teach moms how to assess the pelvic floor muscles, kind of just what I talked about here. But I also teach you how to do some kinesthetic awareness of those pelvic floor muscles. Yeah. And that's really tapping into feeling where those muscles, you need to do it with your partner. And I teach you how to get your partner to do this so that you can feel where that baby is going to be putting pressure as it comes through the pelvis here. And when you feel that pressure, that's your sign that you need to relax and let go.
Oh, yeah.
And do you remember that with that baby's head, as soon as it hits pressure down here, that's when the muscles need to relax and open up even more.
But with fear, if we approach birth from a perspective of being afraid and even afraid of tearing, of course we're going to clench down. And so it's that whole fight or flight reflex. So to get to the point where we can relax, we have to realize and short circuit and transcend above any ideas of fear or flight and just being totally present in the moment and accepting that pressure on us.
Exactly. And that's what I'm trying to do with that proprioception of being able to feel where that pressure is going to hit and, being able to recognize that and say, okay, relax into that. And then there's a breathing technique and a sounding vocalization that I teach in the simple steps for a smoother birth that can really help lengthen those pelvic floor muscles versus tightening it up. Okay.
Amazing. Yes. Sounds like an amazing course, Lynn. I'm sure that by the time this webinar is out there, Lynn's course will be up there and you can find it. Where do they come and find it, Lynn?
So check out my website, instituteforbirthhealing.com, and go to the mom side and it'll be under courses there. Okay. So check out my website. And also I would love for you to join. I have a Facebook community. It's called the Institute for Birth Healing Community. So if you search that on Facebook, you need to ask to be joined. And in that community, it's such a great supportive community of both moms and practitioners alike. So if you have any questions, any concerns, you can just create a post and you will get all the feedback. And I tell you, there's never been any negative feedback from anybody. It's just so loving and supporting.
It's a beautiful group. And there's 5,000 people in it.
Yeah, there's over 5,000 people in there right now.
It's so wonderful. You can really tell when a Facebook group is so positive like that, and yet there's so many people in it. It's because it's being run by people who, have a beautiful outlook on life and about healing. Yeah. Have you got any tips for mums post-birth about how to heal after birth if maybe they haven't heard this information in time enough, like me in my first birth?
Right. Yes. So you know, it's so couple of key things that happen to us post-birth is one of the things, remember I was talking to you about how these bones have to open up to
Yeah.
get the baby out?
Yeah.
Well, depending on your reaction, depending on the length of your labor, your pushing, or really what happens in that labor room, there can be a trauma response in your body. So as natural as childbirth is, it can be traumatic.
Yeah.
And we need to understand what that trauma response is in the body. And sometimes, usually that trauma response happens when we're pushing, which means that the bones of our pelvis are in this open position here. And I have found that some women, these bones aren't going back together after birth. So they're left in this open birthing pattern.
Yeah.
And so, and then sometimes, remember, a baby doesn't always come out evenly.
Yeah.
So now one side is out more than the other. And so moms may feel like, I just don't sit as evenly as I used to.
I think that's me. I'm thinking, oh my God, I'm I actually it's still like 6 years after my last birth.
Yeah, and I found this. Remember, I started working on all these postpartum women, found all these common patterns in the body. And then I went home and I was working on my aunt who had a 47-year-old son at the time. Her first birth was horribly traumatic. And I found the same open pattern in her pelvis 47 years later.
Okay.
So it is very possible that some of these, you know, issues remain in the body after birth. So it's very possible. And I just did a training down in Melbourne. So there's a couple of great practitioners in your area.
We'll talk after
Yeah.
tell me
Well,
who, because I'm thinking that must be it, because my hips just don't feel right. And and you live with it as a mum. You put up with so much crap because you're out there, you've got to do the lunches, do the driving, do the sports, do the first aid and kisses, and get on with it.
And we do, and what ends up happening is that everything that we're experiencing gets discounted because our focus turns to the baby and taking care of the baby. And that's what saddens me so much. And that's why I'm so passionate about the work and about the Institute for Birth Healing, because too many women are struggling and hurting after birth, and they don't need to be. And so finding that, one of the things that I have on my website is a directory of all the practitioners who I've trained. So please check out the instituteforbirthhealing.com/business/directory. It will get you there, or go to my website. You'll find it on the website there. But there's a directory of everybody who's taken my courses. And if you're postpartum, make sure you find someone who's done the postpartum course. Down in Australia, I've taught everybody who's come to a course knows both the pregnancy and the postpartum. So please go see a birth healing specialist. They can help you get your bones back together. They can help you sit more evenly. And the thing is, Akasha, is once a baby comes on out, there is no sense of normalcy left in the pelvis. Like you don't have any idea what normal feels like, right? Until you have a session and things come back together and you go, oh, that's what I used to feel like, right? And so with that, a lot of women are walking around with this open birthing pelvis and they have no idea, okay? But one of the key signs that your pelvis is still open is when you get pregnant again and now you start having pelvic pain. If you did not have pelvic pain during your previous pregnancy, you give birth and now you get pregnant again and you start having pelvic pain, that tells you your pelvis is still open, still affected from that first birth. Okay? And so what happens is that, our body is amazing at its resiliency and its ability to cope. So, your pelvis is in this open pattern, okay? It's splayed open a little bit more than it was, but your body can manage it until you get pregnant again. And now you add more of those hormones into the laxity of those ligaments. And now your pelvis is too loosey-goosey in this. This is an unstable position. for your pelvis. Now you add a pregnancy to it and it can't handle it, and that's what creates the pain. And I have helped so many pregnant women get out of pelvic pain in one session by just helping to close their bones back up, getting them out of that birth healing pattern, the open birthing pattern in their body. And then they can function better. They don't have pain anymore.
This is amazing. I think definitely check out Lynn's website, find out, I mean, you've been in 6 countries, you said, find out what countries you can find a practitioner, because, having been myself on numerous healing journeys, post-birth and before birth and everything, I can really say that I've been to chiros, physios, masseuses, who else? Like 10 other different types of body workers. I can't even remember all their different kinds of names. And no one's ever examined my pelvis, even though I've said my pelvis doesn't feel right. No one's ever examined my pelvis, other than that, and gone, from a perspective of like postpartum, postnatal, what might be different and what might have changed. No one's ever done that. So obviously we need to go to someone who's a specialist like you, who does specifically postpartum kind of care.
Absolutely. And, this is when I found this when, remember, I just saw postpartum women. That's all I saw in my practice. I didn't see all these mixture of things. I just saw one type of person.
Yeah.
And when they would lay down on my table, their right hip, their right ilium would be more towards the ceiling.
Yes.
As you lay down, if you put your hands on your hip bones, the front of your hip bones here, if you put your hands right here and you feel that right side is higher towards the ceiling, that's a sign that you're in the open birthing pattern.
That's me. Is that because the baby is generally on the optimal positioning of one particular side? No, what happens?
So what happens is, what I find is that the sacrum should be right in the middle of the pelvis here, right? What happens during birth is that the sacrum gets shifted over to the right-hand side, and it jams up this right SI joint. So the sacrum now, instead of being nice and midline, is crooked in there. And that's what's causing that rotation. And so I've learned there's two different techniques that I do to get that sacrum back into its normal position again. And once I do those 2 little things, it takes under 5 minutes to get the sacrum back into its normal position, and women are out of pain. And just like you, Akasha, these moms were coming to me and they've been seeing chiropractors for months. They've been seeing massage therapists for months, and they're still having pain, usually more right-sided low back pain.
Yeah.
And I do my 5-minute little thingy, and then they're out of pain and things they function better.
I didn't expect to be getting so much out of our conversation today, Lynn. I mean, I've gone through many different bodywork journeys through healing, and I really didn't think or conceive that I could possibly be finding out so many more keys to healing. So, I mean, obviously, the wisdom that you're giving the world is very important, and we really got to work together, make sure everybody finds out about this, because, oh my God. Like these little niggling pains. I mean, if your pelvis is out, everything's out. Your hips, your legs are out, your knees are out, your ankles, your feet, your neck, everything. And just life, oh my God, becomes so difficult. So that's so amazing.
It's the foundation. Our pelvis is our foundation. It's the transfer of weight bearing from the legs into the trunk. And so if it's off balance, it can't transfer the load easily. And like you said, it throws everything off. And, it really makes me really sad that so many women are suffering after birth. And I know I have the big piece of the puzzle that I just need to get into more practitioners' hands to be able to help more moms. So moms, if you're listening into this interview and you're needing help and there's not a birth healing specialist in your area, please let go. If you're seeing a chiropractor, if you're seeing a physical therapist, let them know about this body of work and tell them to go get certified. Tell them to come take my courses so they can learn how to better help you.
Absolutely.
And I'm serious. It doesn't have to take 6 to 12 visits to get you better. when you know what to do and how to do it,
Yeah.
it shouldn't take more than a couple of sessions for you to be feeling better in your body. So
Fantastic, Lynn. How do people follow you on social media? What are you on?
so it's on everything. YouTube, I have over 30 videos on YouTube. So the channel is Institute for Birth Healing. We're on Instagram, Institute for Birth Healing. We're on Facebook. Institute for Birth Healing Community is our private Facebook group, which is so active. And I really try to keep educating. I do Facebook Lives in there. I interview experts. And then once a year, I do a birth healing summit. Each spring, I do a birth healing summit. It's more geared towards practitioners. But again, let your practitioners know that this information is out there so that they can better support you in your healing journey. Because it is a journey, but finding the right practitioners is really critical for helping you to feel better in your body after birth. And you really do. And the Institute for Birth Healing is here to help you have a more complete healing after birth. And my birth healing specialist can so help you do that.
That's amazing, Lynn. Thank you so much for being with us. Just one last question before you go. I guess, what is your vision for womanhood? You know, if every woman in the world, like, who'd had a baby or was going to have a baby, had their pelvis looked at and the body weight done and the healing happened, what would your vision for womanhood be?
So here's one of the things that also happens postpartum is that because birth can be a little traumatic, it can be massively intense, a lot of women disconnect from their pelvic space. Okay. Yes. And so what I teach my specialists to do is to help moms reconnect back into their pelvic space. And I can't tell you the power and the potency that lies in that pelvic space. And so it truly is my dream that for womanhood, that we all reclaim and learn to live from the power in our pelvis. And I tell you, it can change your life. It can change how you show up in the world. And my advanced trained practitioners, they know how to work with the energy in the pelvic space. And there's a visualization that you can do to see what's showing up in your pelvis. Our pelvis, you know, this kind of looks like a little bowl here. And so you can visualize the bowl of the pelvis and what's showing up in there. There's a map to it, and you can learn how to read the pelvic space. I know we're going into a whole nother topic here.
This is brilliant. This is brilliant because for me, the pelvis is the home, like of our integrity, of who we are, of our kundalini, everything, you know.
Absolutely. I do say that our pelvis is our home, and it's our job to come back home and to learn to live in the bottom of your bowl. That's the key. So many women are actually energetically on the top of their bowl, and they need to learn to live from the bottom of their bowl. And it's such powerful work, and it can really change how you show up in the world. You show up more powerfully, more secure. I talk about the womb is our truth center. It's our creative center. You know, there's so much potency. And I love Ina May Gaskin says that if men had uteruses, they would be bragging left and right about it, right? I mean, there's so much power and energy in that uterine space that we need to be really honoring that and connecting into it and learning how to harness the energy in that space. And so that truly is my dream and goal for all women, that everyone reconnects back into the space and learns how to truly live in that empowered, passionate, self-loving way that we're meant to.
It's a beautiful vision, Lynn. Everybody, thank you so much for joining myself and Lynn today. There's lots more wonderful webinars to discover. I'm sure Lynn's going to be back. We're going to have a second conversation, probably from that, you know, that vagina power.
Yes, awesome.
Vagina power. And everyone, you can follow Learning to Birth at Learn to Birth on Facebook and Instagram. So thank you, everyone, for joining us.
All right. Bye, everybody. Thank you.